We'll start session quickly now. So today I'm going to take a session on the how to suture and what skills we needed to be a better surgeon, because suture is the signature of a surgeon, right? So how to first of all before taking any suture, we have to know that how to handle the instrument first. If you are not knowing how to handle the instrument, then you won't be able to take a proper suture. So in order to achieve maximum potential from your any surgical instrument, it needs to be handled correctly and carefully. So what are the basic principle of all instrument handling? That includes a safety, because if you are not handling it properly and if you will get a needle prick or the instrument injury or knife injury, then you can get any infection. So safety is must. Then ergonomic of movement, relaxed handling and avoidance of awkward movements. So ergonomic of movement is that while using any instrument, you have to move your wrist or you move your elbow or whatever joint you have to move, and you have another partner, a nurse staff or an assistant surgeon or any junior resident with you. So during that, you have to take care of every instrument working together, right? So you have to keep all movements in proper way at that time. So this is the basic principle how to handle any instrument. So here I have shown few pictures showing that how to hold any instrument. So first of all, scalpel. You can see in both the pictures that how the surgeon has hold the scalpel with the index finger and given support by the thumb. So he is going at a 45-degree angle, not on. He's not stabbing at 90-degree angle, right? So another method is you can hold it with first, second, and third finger and give support by another hand, and your thumb is again on the handle. So as in Caesar, also we have to hold it in a manner that your ring finger and thumb should be in the ring of a Caesar, and by the middle finger you are supporting the Caesar and nearby the ring, and on the shaft you will give support, on the nearby the screw you will give support by the index finger. Another is a forceps. So how to hold a forceps? It can be a simple tooth forceps or it can be artery forceps or any other forceps. So you have to hold the artery forceps with the same manner as you have hold the scissors, right? So you can notice here, you can hold it with the index finger and with the ring finger and the thumb, and you can give support with the index and middle finger. And in forceps, tooth forceps or simple forceps, you are using the spring movement. So you are just holding it with the index finger and thumb. So you can press it and open it together, right? Then after that, a needle holder. So how to hold the needle holder? Again, the same manner with the thumb and the ring finger in the rings of the needle holder. By index finger, you are giving the support on the screw part of the needle holder or on the shaft of the needle holder, and with the middle finger putting nearby the ring for the support. So you can open it and close it very comfortably, and you can insert a needle at exact 90-degree angle. So you, with the rotation of your wrist, the needle will come through on the opposite side. So these are the basic instrument you should know how to hold before taking any suture. Scalpel, because once you are incising, you have to suture it. So you know you must be knowing how to hold the scalpel. Another is scissor. Again, you are cutting anything, you must be knowing how to hold it, and you need a scissor again in while after the taking a suture you have to cut the suture. For that also you need to how to know you need to know how to hold the scissor. Forceps, again you have to hold the any thread with it or any tissue for the support before taking a suture. So you must knowing how to hold the forceps. And again, needle holder, it is most important. You all must be knowing without needle holder you can't take a stitch. So these are the basic instruments you must be knowing how to hold it. Okay. Sorry again for one more delay, one more break. So we were on the how to handle the instrument for before taking any suture or right. So for suturing, it's not just going from one point to another point. It's about taking a note or tying it, how to handle an instrument, how to go through the tissue. Everything is important, right? So now another important aspect of suturing is notes. We will discuss on notes. So what are the general principles of note tying? Why it is important? So the note must be firm and unable to sleep. The note must be small as possible to minimize the foreign material. During tying, do not saw the material, as this will weaken the thread. Do not damage the suture material by grasping it with artery forceps or needle holder, except at its free end, right? Otherwise, you will tear it or you will damage the thread. Avoid excess tension during tying, as this could damage the suture being ligated or even causes breakage of suture material. If any of you have taken suture in ward, you must have noticed while tying it, while taking a note, if you are using more tension, more power, if you are using, it will break. Most commonly seen in the Prolin suture and other silk suture and all, right? So you must have noticed, or if you haven't noticed, you should go to ward and take a stitch or tie a knot and try to give attention. Not on patient. Don't do this on the patient. You can do it on the other thing also, on the robot also, right? Or you can use banana and any other thing, and you can tie on it, or on the sponge, like Kishan Rao sir already have taken lecture on that. Another is avoid tearing of the tissue by being ligated by controlling tension and bleeding and beating down of the note very carefully using the index finger or thumb appropriately. So this is why this is important, because if you are tying note and you are giving pressure from upside, you are not going down with the note. If your finger is not going down with the note, then what will you do? You will push it up, push the tissue above towards you. So what will it cause? It will tear the tissue, it will damage the tissue. So you have to take care that you don't damage the tissue. So for that, you have to use your thumb and index finger to go with the note and put it appropriately, right? And the first and second point was saying that it should be firm and unable to sleep. If it is not firm, it is loose and it will sleep, what will happen? It will be open up after some time, and it will cause a secondary bleeding or wound adhesion, or anything can happen, right? So to prevent the complication, we have to take care of it. Okay, and it should be small as possible, because if it is a very large or very big note, so you must have read that. If you have read sutures, you must be knowing that there is a single, or there is a beaded suture, or in beaded or multi-layer suture, there are chances of foreign material. Same knowledge applies here. If you are putting multiple notes and it is very big, so between the notes, foreign material can lie and it can cause secondary infection. So you have to take care of that too, right? So this was about general principle of notes. So what are the types of notes? Once you are knowing that these are the principles, these things I have to keep in my mind and I have to take care of it. So what sort of notes you can tie? So there are one-handed reef note. There is an instrument tied reef note. Why I have mentioned both things, one-handed, two-handed reef note, or surgeon note, and instrument tied notes, because at times, if you don't have any instrument to tie a note, you should be knowing, being a surgeon or being a resident or being a doctor, you must be knowing that how to tie a note without an instrument too. So for that, I have put a small video clips over here. I'll be playing it after this. So there are notes, this type of notes, and I'll show the video of all of this accordingly. So there is one-handed reef note, there is instrument tied reef note, there are two-handed reef note, the surgeon's note, that is one-handed, and instrument tied surgeon's note, and the sleep note, that is a granny's note or a false note we are saying, and tying at the depth. Why tying at depth I have mentioned here is, this is to justify this point, that to avoid the tearing of the tissue being ligated by giving over pressure, or tearing the tissue, or not using the index finger and thumb with the moving with the note. To justify that, I have mentioned that too here. So we'll go to the one-handed reef note now. I'll play a video, listen it carefully, notice each finger movements and each line of it. I have kept the pictures of that too, all steps pictures in the next slide too. But before that, just listen this video carefully. One-handed reef note. While taking a reef note, take a short end in a left hand, long end in a one-handed reef note. While taking a reef note, take a short end in a left hand, long end in a right hand. Short end between the middle finger and thumb long end between the index finger and thumb. Take a short end just above the index finger of left hand. In second step, bring the right hand over the index finger and put the long end over the index finger. Now flex the index finger and bring this note below and from behind the first note, and then take a right hand away from you and left hand near to you. This is your first note. Now in one-handed method you have to use just one hand, the right one. So now, keeping the short end between the index and thumb, take the thread above the below three fingers, middle, ring and little finger, and bring your right thread above it. Now use the middle finger throw. In middle finger throw, just take the thread below the long end, and now go in opposite direction. Left hand away and right hand nearer. This is your reef note. That both the threads are coming from below here, and these two are coming from above. You can see the reef note. So I hope you understood this. So after seeing a video, now I'll show you the pictures, the steps, each steps by each picture. So I hope you will get it easily. So this is about the one-handed reef note. So first index finger throw we'll use. So in that, first of all, short end will hold with the left hand, and the tip of the thread will keep it between the middle finger and thumb. Right? You can see in this picture that you are keeping it in between the middle finger and thumb. After that, you are taking this thread over here above the index finger. So you are taking it above it and taking it ahead of it. After that, and still this thread end is on between the index and middle finger only. Keeping it middle finger and thumb only. Keeping it between the middle finger and thumb. Now you will take your long end, which is on your right hand, above the index finger now. So it will go above the index finger now. After that, you will take this long end from below to above, from behind to behind of white thread. So your long end will pass behind the long thread. So you will make a note after that. So it is passing from behind the index finger. You are taking your index finger above the white thread now. In previous slide, it was above this. Both are on the same side. In previous slide, the short end and long end both were on the same side on the index finger. Now you are taking this purple long thread below, and you are taking your index finger also below the white thread. So now what happened? White thread will go below and purple thread will come above. So this will make a proper note. If you can appreciate here. See, this white thread from above, it has gone below, and this purple thread has gone from above to below and coming from behind the white thread, and from here also it is coming from behind. So this is making the first portion of note. This is white, this is your purple. After that, now index finger throw has been over. Now it is about the middle finger throw. Your thread will be between the index and thumb now, white thread. Long end is in the right hand, short end is in the left hand only. Now what happened? This purple thread, the long thread has gone on the opposite side and white thread has gone towards you. You can see, if you can appreciate in your this slide. So after that, you will take this white thread between the index and thumb and above this three fingers, that is middle, ring and little finger, and you will take this long end over these three fingers to keep both the threads parallel. So again, you will take this thread from below the white thread and take your middle finger above it, and that will make your another throw, if you can appreciate here. And now your short end will go again away from you and long end will come near to you, right? which was previously, from where you have started. By this, you will make a reef note, a true note, in which both side, this white thread is coming from above here, and both this white and purple on this side is coming from below. I'll teach you that the difference between the grainy and reef note. So first of all, appreciate this. This is the loop. From loop, the one thread is coming from below, another thread is also coming from below. It is not like one is coming from below and another is coming from above. And here, next to this loop, both the threads are going from above, not passing one above, one below, right? So now you will see the how to tie this reef note with the instrument. Till now you have seen from index finger throw and by the middle finger throw. Now you will see that how to tie the same note by the instrument.
Reef note by instrument, same. Keep short end away from you, long end near to you. Now you have to put your instrument needle holder above the long end. Then make a loop. Then take a short end with your needle holder. Go away as we are doing before. Long end away from you, short end near to you. Now again you have to put the needle holder above the thread and make a loop. Again catch the short end. Now go to the opposite direction. Long end towards you, short end away from you. Again you have made a reef note, a proper reef note. Both the end going below, both the end coming out.
Okay, so this was about the instrument tied reef note.
Reef note by.
So now we'll move to the steps of instrument tied reef note. In hand tied reef note, one-handed reef note, we were using the index finger thumb, middle finger thumb, and we were using index finger throw and middle finger throw, right? So in this, we will use instrument. Again, the white thread, which is the short end, is away from you. The long end, the purple thread, is near to you, right? So in this case, we will put an instrument above the long end. We'll make a note, we'll go above this instrument, we'll take a long end above the instrument, and we'll catch the short end now. And we'll tie the first note. If you can appreciate here, this is the first note you have tied here, right? It is very simple. It's not like the one-handed reef note. It is instrument tied note is very simple. You have to put an instrument on long end. You have to catch the short end. You have to tie it. And again, in that, long end is going away from you and short is coming near to you in first throw, like in the handed tied reef note, right? After that, you will put an instrument again over the long end. You will catch the short end and you will tie the another note. And like a handed reef note, one-handed reef note, in this also, our short end will go away and long end will come near to you, right? So end should be like this. So again, both the thread coming from below the loop and coming from above the loop on the both the sides, right? It is not one is from above, one is from below, right? That is important. You have to remember. This is about instrument tied reef note. So after that, this is a reef note. We have seen of instrument tied reef note and one-handed reef note. There is two-handed reef note also. So how to tie a reef note with the two hands? So we'll see a video of that too now.
One-handed reef note. As always, keep short end away, long end near you. Short end in left hand, long end in right hand. Now in this double-handed note, keep the white end, short end in between the index finger and thumb, long end between the middle finger and thumb. Then bring the long end towards the short end over the white thread. Hold it between the middle finger and thumb. Now pass the short end with the another hand. Use another second hand and make a loop. Take your right hand away from you, left hand near to you. Then change the hand. Take short end in right hand, long end in left hand. Now take again a short end above the right hand with the short end above the purple thread, the long end. Pass it below and behind it. Now again take a long end in right hand, short end in left hand, and make a knot. That is a reef knot with the double hand. You can see both the thread coming below the loop, both the thread coming above the purple loop below. Handed
So,
reef knot.
In two-handed reef knot, we are using both the hands, right? In one-handed reef knot, we were using just one hand, the left hand. First index finger throw, second was the middle finger throw, but both was by the left hand only, right? The right hand we were using just to give the end of the long end of the thread, right? In two-handed reef knot, we are using both the hands simultaneously. So that is, we are keeping the long end again on the right hand and short end on the left hand. Likewise, in the one-handed reef knot, we are making a loop. We are taking the short end from below of the purple loop, that is the long end, and we will make such loop here. And again, short end will come near to you and long end will go far away from you, right? That is at the end of your first throw. You are changing your hands after the first throw. You will hold the long end with your left hand now, right? Till now your left hand was taking the short end only, but now you are holding the long end by the left hand, short end by the right hand, right? After that, you will make another loop by taking the white thread above the purple loop. You will take it above, and from behind the purple, you will tie another knot. Here, if you can appreciate that your white thread is going from above the purple loop and coming from behind the purple loop, from purple thread from this loop. You can see, if you can appreciate this triangle of here, this is the white thread. I'm passing it from above and from behind from this loop, this thread, and this will make this knot, the reef knot, in which again your both the threads, purple threads, are coming from below the loop, this white loop, and one side both the white thread are coming from above the white loop. Okay, this was about your two-handed knots, two-handed reef knot. Now we'll move to the surgeon's knot. That is most important knot, as in many surgeries, in many important in tying many arteries and things, we are using surgeon's knot as it is safest knot to use, right? So what is how to tie a surgeon knot with one hand? So I'll show the video now of one-handed surgeon's knot.
One-handed surgeon's knot. Keep short. One-handed surgeon's knot. Keep short end in left hand, long end in right hand. As a reef knot, keep the short end between the middle finger and thumb, long end between the index finger and thumb. Take a short end above the index finger, put the long end above index finger, flex the index finger, take a one throw, keep your index finger still in the loop, take another throw. Do not complete the reef stroke. Now bring the long end away from you, short end near to you. You can see the two loops here, 1 and 2. Now, like a reef knot, middle finger throw. In that, put the short end above the middle finger, ring finger and little finger. Take a long end above it. Now first middle finger throw. Again keep middle finger inside. Take another middle finger throw. Bring the short end. One-handed surgeon's knot. Keep short end in left hand, long end in right hand.
Again
as a reef knot, keep the short end between the middle finger and thumb, long end between the index finger and thumb. Take a short end above the index finger, put the long end above index finger, flex the index finger, take a one throw, keep your index finger still in the loop, take another throw. Do not complete the reef stroke. Now bring the long end away from you, short end near to you. You can see the two loops here, 1 and 2. Now like a reef knot, middle finger throw. In that, put the short end above the middle finger, ring finger and little finger. Take a long end above it. Now first middle finger throw. Again keep middle finger inside. Take another middle finger throw. Bring the short end away from you, long end near to you. You can see the true surgeon's knot, that two threads are coming below the loop and two threads are passing above the loop, and there are two knots.
So now we'll go on the steps of how to tie a surgeon's knot. It is as same as reef knot. Why? You are using all the same throws like you are using in the reef knot, like index finger throw and middle finger throw. But in reef knot we were using just single index finger throw and single middle finger throw. Now whereas in surgeon's knot we are using two index finger throw and two middle finger throw. Right, so you can see the two double notes, double loops inside it. So that is making the surgeon's knot more secure than the reef knot, right? So if you can appreciate, likewise in the middle finger and thumb, I have took this short end, long end is again on my right hand, putting on the index finger, then going to the taking this white thread below the index finger and taking it out of this loop of purple and white thread and making the first loop. After taking the first throw, I'll take another throw of white thread. If you can appreciate here, that is I have already made this first loop here, right? This is the first loop here, and I am making the another loop, another throw I am taking, second index finger throw. So that will give me the two throws, two loops, 1 and 2, right? So in reef knot there was just one loop. And whereas in this, I have two loops, 1 and 2, right? So after that, middle finger throw is as same as the reef knot. Like a reef knot, I'm keeping both the threads parallel, short end in my index and thumb, and long end on my right hand. I'll pass the middle finger throw. I'll repeat that middle finger throw again. So that will give me two loops of middle finger throw too, right? So this will give me the picture of, if you can appreciate in both the pictures. By index finger throw, this two loops are here, 1 and 2. By middle finger throw also, I have two loops here, 1 and 2. So that is giving my this two loop surgeon's knot, a safe knot. And in that also, again, like a reef knot, both the threads are coming from below on this side, and both the threads are going from above on this side of last loop. There is nothing like one is going above and one is going from below on the opposite side, right? What I am saying is, on the one side, there should be both the threads should be passing on the same alignment. Like if one is going from below, another one should be going from below. It should not be like one is going from below and one should go from above. That is the wrong note. That will be a grainy note. I'll discuss it on the later stage. So now I'm moving on to the instrument tied surgeon knot. Like we saw in the reef knot, that we are putting an instrument over the long thread, we are making a tie, we are catching the short end, we are making a loop. We'll do a double loop. We'll make a double loop of purple thread here. I'll show you on the video, so you'll understand more, you will understand better. So see the video with the concentration.
Surgeon's knot with the instrument. In that, keep short end away from you, long end towards you. Put the instrument over the long end. Make two loops. In reef, we were making just a single loop.
So I have made two loops. Like I have used two index finger throw. I have to use two throws. So one on the needle holder and then again the second one. So there are two throws over here. So now I'll catch the
short with the needle holder tip. Bring the short end towards you and long end away from you. You can see the two loops are forming here. Now put the instrument over the long end. Make again a two loops for surgeon's knot. Bring a short end away from you, long end towards you. You can see this is the surgeon's knot. Two threads are going below coming up from above the loop and two
I have
threads are
kept this
going from
loose
below the
so you
loop.
can see and appreciate it well.
Surgeon's note.
So now the steps. You are making two loops like in the reef knot. You are going, your long end is going away from you, short end is coming near to you, as in the reef knot in first stage. And in last stage, after taking the two loops of long end again, you will get the short end away from you, long end near to you. And that will be your surgeon's knot with the two loops. 1, 2, 1, 2. And both the threads are coming from below and going above. These are going above and these are coming from below, right? So this was about surgeon's knot with instrument. Now I'll show you the difference between the reef knot, the granny's knot, and the surgeon's knot. If you once you will see all three knots together, you can appreciate it well, right? And this thing you can appreciate only once you are tying the knot or seeing a proper picture of knot. Otherwise, you will make mistake always. So there is, the first one is your reef knot. As you have seen, the single loop you are making, both the threads are going from below, both the threads are coming out, right? In granny's knot, what is happening? There is also single loop, but it looks messy. Why? Because you can see, you can appreciate this loop is same over here, but this one is coming from above and this one is going from below, right? And here again, this both are coming from below, like it is coming out of something in this case, in the reef knot. Whereas in this, the only one thread is coming out and another one is going from above. So that is your wrong knot, because you will get the many places for the foreign body lodgement, or it can get open also because it won't make a proper tie, proper knot, right? So this is your granny's knot, the false knot, and here it's a surgeon's knot, as a reef knot, but there are two main loops, right? You can appreciate 1, 2, 3, right here, because of two throws you are getting this surgeon's knot. In that also, if it is right, both will come out together, both will come in together. It won't be like this, one is coming from below, one is going out from above. Sorry. So I have put the points of each thing over here. As I said before, there is nothing in that, but I have kept picture mentioning each thing. So whenever you read, you can pause over here and you can repeat and revise it again, right? This is the same thing I spoke just few minutes before. So now, tying at depth, why it is important? As I said before, while discussing the principles of tying knot. So tying at depth is used for the knot tying deep within a body cavity. When you are doing a laparotomy, you won't get everything on surface. Like you are practicing on the skin stitches, or you are practicing on any sponge or any robotic thing, or on the bananas or any pill, right? So you will have to practice this tying at the depth also, practicing on the tying of the depth also. So you can put a proper knot, you won't damage the tissue, and your knot will be secured. So it is essential the knot is tied firmly to avoid slippage, whilst upward pressure is avoided to prevent tearing of the tissue, as I said before. I don't have my own video, so I have kept this another video of tying at depth. I'll show you that.
Which we're going to pop underneath to where we're going to tie. We've got our short thread in my left hand, long thread in my right. And just like with a normal one-handed knot tie, we're going to, which is currently facing up between my thumb and ring finger, facing upwards. We'll use the middle finger and down, and then the difference with this one is that we're going to be pushing that.
Now he is going below in the depth, like we are going in the body cavity. So focus on that how he is pushing the note with his index finger and going below towards the tissue, not pulling the tissue above. He is going with the note towards the tissue, right? That is important to notice. If you can appreciate.
Down and past. I'm not pushing on the knot. I'm going to be pushing down and past where we want it to go down. And,
so now
and then the difference with this one is that we're going to be pushing that thread down and past. So not pushing on the knot.
You can appreciate
pushing down and past where we want it to lie. Then bring the short thread up the other way, as you can see here. Below. So using your thumb and first finger to bring that short thread up this time. Long thread coming back the other way. And then you're using your middle finger to bring the short thread down and through.
Again, he's
exactly
going
the same.
below with his
We're pushing down and past the knot, not on the knot.
This is what I wanted to show you.
And last.
So it's about tying depth, right? So now moving on to what are the forms of suturing? What type of sutures we can take on the body or in the inside the body, right? So there are simple interrupted sutures. There is a continuous suture. There is a mattress suture that can be a vertical mattress or horizontal mattress sutures, or it can be a subcuticular sutures or inverting and everting with the inverting and everting technique, right? Here I have shown you the picture. That is of a vertical mattress, horizontal mattress, simple suture, and continuous suture. Simple, interrupted, and continuous suture. So before taking any suture, you should know the basic principle of suturing too. Otherwise, you will make a mess. You will create a complication. So for that, you must be knowing the principles of suture. What are the principles? As I have mentioned twice before, that tension you have to keep in your mind, that attempt to remove all elements of tension from anastomosis must be there. If you are giving more tension, you are rupturing, you are tearing the tissue. So you are damaging the tissue while repairing it. So what's the point of repairing it? So you have to keep this tension word in your mind while taking a suture, that you don't give a more tension that can damage the tissue. Another is you have to insert the needle at the right angle to the tissue and gently advance through the tissue, avoiding shearing force. Movement should be with the curve of the needle. So what I'm saying is, if you can appreciate the picture, insert the needle at the right angle. This is the tissue, this is the 90 angle I'm going below. So at the right angle I'm going in, and I'm moving this with my wrist movement. Like if this is, I'm putting the needle, I'll use my wrist like this. So it will cross the tissue very smoothly. It won't give any tension to the tissue, but it will give a shearing force, and it will come out of the tissue very easily. Like a needle curve, it will come out like a needle curve, right? That thing you have to keep in your mind. Another is, as the rough rule of thumb, you have to keep in mind that if this is the suture, if this is the incised wound, or it is the lacerated wound or CLW, so your stitch should be on the equal distance from the your incision line, and there should be 2x distance between the each sutures. This first suture, and between the first and second suture there should be 2x. If this is the x, this should be 2x distance, and if this is the x, it should be x only, right? If this is 1 centimeter distance, this should be 1, and this should be 2 centimeter, right? And this x is, how we count this x is, this is the depth of your incised wound, depth of your CLW. It should be equal to your depth of, if the skin below the skin there is this much of tissue, this is 1 centimeter tissue, you will keep distance 1 centimeter. So that is your x. We are using x distance here and 2x distance between the two sutures. So as a rough rule of thumb, a distance from the edge of the wound should be correspond to the thickness of the tissue being sutured, and successive sutures to be placed at twice distance apart, that is double the depth of the tissue being sutured, right? That should be that you should keep in mind. Then what another thing you have to keep in mind, that all sutures should be placed at the right angle to the line of the wound, at the same distance from the wound edge, and the same distance apart, in order to for the tension to be equal down the wound length. No suture should be tied using too much of tension, as it will cause strangulation and necrosis of a tissue. No, it won't just tear the tissue. It can also cause, if it is not tearing the tissue, it can cause the damage or necrosis or strangulation of tissue by compressing the vessels. Right? By compressing vessel, it will compromise the blood supply of tissue, and that will cause secondary infection, secondary necrosis of a stitch line. Right? Wound infection you will get after that. So necrosis leading to the failure of a surgery, that is in case of bowel leak of the skin, will cause the abscess, stitch abscess. Sutures that are too tight will cause ischemia leading to the necrosis. Go through one edge at a time. Don't take two edge together. हाँ मैंने if ऐसे कभी कभी कभार होता है कि हाँ मेरे को आ गया है, मेरे को स्टिच लेना बहुत अच्छे से आ गया है, तो जैसे इंटर्न को बोलेगा कोई रेसिडेंट या फिर फर्स्ट ईयर होगा, when we'll ask him to take a stitch, he'll be like, okay, फटाफट से दोनों साइड से निकाल देता हूँ. But in that you are damaging a tissue. You don't know how much depth you have taken from one side and how much is you are taking it. It is equal or not, right? You can tie it, but it won't be proper way to do it, right? So many are doing it, but that is the wrong practice. So you have to keep in mind that at one time you have to go through the one edge only, not the both the edges. And this is at the your if incise wound is here, every stitch should be at the right angle. It should not be like this. One is like this, one is like this, one is like this. It should not be looking like that. It is not just cosmetically damageful. It won't just give a cosmetic compromise, but it will give tissue compromise too. Tension will be different at the different stitch line, and that will can also damage the tissue. So after that, if there is an elliptical wound or long wound, what should you do? That in case of long wound, one can choose to start at the center of the wound. We can start taking stitch from the center of the wound, right? And proceed to the either end of the wound, like starting from center and proceed to the both the side, either end of the wound. In case of elliptical wound, what you should keep in mind while taking stitches, wherever possible, before excising or plan the wound, the length of the elliptical wound should be 3 times of the width. Like if this is the elliptical wound, it should be 3 times. So it should be, you can take 1, 2, and 3 stitches at the equal distance. It should be 3 times of the wound, right? So tension will be divided equally, right? So you may have to undermine the skin edges to close the wound, but never closes the wound under the tension. Here you close by starting with a stitch at the either end of the wound and continuing that way, right? You can start from either way, or you can start from middle part. Another thing is skin suture. Interrupted sutures should be removed flush to the skin to avoid contaminated exposed material passing through the skin, right? And cut notes approximately 0.5 centimeter from the note and try to lay the notes on the same side. So here the correct methods I have mentioned, that it should be on the equal distance on the both the side. It should not be like you are taking this much distance on the one side, another side you are taking more distance. That is also a wrong practice. So you have to keep that in mind. That is, unequal spacing is not allowed. It's not the right practice. Excessive tension, here you can see that skin, here you can see that skin is not stretched. It is not in tension. You can appreciate here that skin is in tension. It is give this appearance, lumpy, bumpy appearance due to excessive tension. It will get everted like this, right? In this case, it won't be everted. It is straight in one alignment. It is due to excessive tension. It will be everted here. You have to keep all the stitches on the same side. One you are putting on this side, right, and one on the another side. That is also not good practice and not a right method too, right? So skin inversion is also not allowed. When you are putting too much pressure and you are going below the stitch, it can invert also, and skin overlap is also not good practice. So you have to keep all this thing in your mind, that it should be in one alignment above and below. It should not be inverted. It should not be everted, right? It should be in one alignment at the equal space, equal distance. right? I have likewise I have said x is thickness, it should be x distance from the incision, and 2x between the two stitches. It should be in one line only, no excessive tension should be there, right? These are the point you have to keep in mind. So here I have kept another picture of what are the types of sutures you can take in your practice. So there can be a simple interrupted suture. In that simple interrupted suture, you are taking, this is 1 2 3 cycle is I have shown here. You are you are putting your needle from this side of incision, you are coming out in the wound, and you are again coming out of the skin over here, and you are tying knot here. This way you are putting a simple interrupted suture, right? In simple continuous suture, you are inserting needle from the one end, you are going between inside the wound and coming out of the wound, and again you are inserting your needle in the at the another point. So it will, there won't be any knot in between, it will looking like a continuous thing, right? Without any knot in between, notes in between. So in horizontal mattress there are 6 steps. First you are passing through the one side of incision, then you are going into the wound. Again inside the wound you are passing, like on the skin you are going from one side to another side, you are going inside the skin or from the one side to another side. Like if this is the wound here, I have came out, I'll go inside only at the from 3rd point to 4th point, and I'll come out at the 5th point, and on the 6th point I'll tie my knot from 6 to 1, so it will look like a box, right? Then in vertical mattress what will happen, I'll go from the one edge of the wound, I'll come out of the another edge of the wound, right? I'll again go from the skin inside, and I'll come out of the skin outside. So on the skin from where I have inserted my needle, near to that I'll come out and I'll tie a knot, right? In another in this horizontal mattress, I was coming out on the parallel to the first needle insert. In this I'm not coming out parallel, right? I'm coming out over here, and this was first incision was here, first my needle prick was here, and another is coming here. While in vertical mattress, first I was inserting here and I'm coming out here and tying knot from here to here. I'll make a horizontal line parallel to the incised wound, right? In running subcutaneous suture, I'm going from one part to the another inside only, I'm going from one part to the another part. So these are the types of suturing. There is another type, that is figure of 8 suture. In that we are inserting needle at point 1. We are passing on the same side on the from the same level from the another opposite side. That is part 2. Then after that I'm going to the coming out on the same side where I have inserted the needle, but at the distance. And after that I'm coming parallel to the 4 out of the skin, and I'll make a knot between 4 and 1. So it will give a picture of figure of 8. This is like 8 over here, right? This cross will make a figure of 8 here. So I'm going in from this side, I'm coming out of this side, I'm going in from this side, I'm coming out of this side. So inside it will be like this, and outside it will be look like this. This is inside the skin, and this is outside picture, right? So this was about figure of 8. There is another thing, the tendon repair. It is not important for UG students, but many PG students need this tendon repair, especially in civil hospitals. We need to do it. So how to repair a tendon, how to enter and how to exit. It will look like this at the end, but how it will be. So we are entering from one part of tendon over here. We are exiting from the, if you can appreciate, I have wrote the enter and an exit, right? So one stitch I'll enter from one side, I'll exit on the same side, I'll re-enter from the same side, and then I'll come out at the same point on the opposite side. I'll re-enter my suture, my needle from the same point from where I have exited first over here, I'll come in from this side and I'll come out. I'll take my thread again out of the cut edge of the tendon over here. So this will be the 1, then 2, then 3, then this exit is my 4th one, this is my 5th step, and on 6th step I'll come out, right? This way I'll come out. And same thing I'll do on the another side of the tendon, another end of the tendon. I'll come in from this side, I'll come out of this side, I'll go in again, I'll go out from this side, and I'll go again. I'll go out from this side, I'll go again this side, and both the thread I'll tie, right? This needle, with this needle, here I'll have a needle part. So with this needle part, I'll enter on this side. So it will give 2 threads. This one thread was from where I was entered, and another thread by which I'll exit. I'll make a surgeon's knot or reef knot over here to tie it. And after that, in the second layer, I'll take another continuous suture, that is 2 mm away. There should be 2 mm away from each. By this manner, I'll tie I'll do the tendon repair. So after that, after tendon repair, we'll discuss about this bowel anastomosis, right? So in bowel anastomosis, what we'll do, that is essential for any anastomosis to know that there should be no tension, there should be good blood supply, pulsating mesenteric vessels should be there. So then only it will supply the blood to the bowel. Accurate apposition should be there to avoid any leak, and impeccable and accurate suture technique should be there. As I said before, if your edges are getting inverted or everted, if it is 1 stitch is on this side, 1 stitch is on the opposite side, that will create an tension over the tissue that can compromise the blood supply, that can cause the leak, that can cause the early your stitch can get open up, it can slip away, right? So you have to keep these things in your mind, that these are the essential points before doing an bowel anastomosis. So how to do end-to-end extramucosal anastomosis? You can do end-to-end extramucosal as well as intramucosal anastomosis too when you are doing 2-layer repair. So in single layer extramucosal sutures, we can do interrupted and continuous manner. We can go by this 2 manner. So first interrupted manner. In interrupted manner, we are going from, this is mucosa inside the bowel. I have mentioned the layer here clearly. This is the mucosa. After that, the thin layer, thin muscle layer comes. After that, submucosa comes. Then thick muscle layer comes, and subserosa and serosa comes. So we are going from serosa to inside the bowel, that is inside the bowel up to the layer of mucosa, but we are not crossing the mucosa. That is why it is extramucosal. So we are passing towards the mucosa, we are going towards the mucosa, but we cannot cross the mucosa. We are not crossing the mucosa. That is why it is extramucosal. Again, we are entering from mucosa and clearing all the layer and coming out, and we'll tie knot over here. So that is your extramucosal stitch layer. I have mentioned each steps over here, which sutures we should use, which from where we have to go and where we have to exit, which I have already spoke here, that we are entering from one side, from the antimesenteric border to we are not crossing the mucosa and exiting from the another side, right? And we are tying it in interrupted manner. We are tying at the same distance at each part. In brief, I'll say first anterior wall, one should focus on anterior wall. After that, followed by second posterior wall. 2 stay sutures at the antimesenteric border and mesenteric side we are booting. So if this is bowel, it is cut here. This should be mesentery. So 1 stay suture should be here, 1 stay suture should be here. So it won't slip away. And you can see and focus on the part of a bowel. Intermittent extramucosal stitch over the anterior wall should be taken first from the mesenteric side to the antimesenteric side. We should start from here and go towards here, right? Start from mesenteric border. If this is mesenteric border, we should start from mesenteric to antimesenteric we should go. Turn stay sutures from mesenteric window, make posterior wall anterior. Now, once you have taken this part, now turn the stay suture on the opposite side. So your posterior wall will become anterior wall, and you can take extramucosal intermittent stitch from mesenteric side to anti-mesenteric side now. So once you have this stay suture over here, your cut part is here. Now you are putting it on the opposite side. You can see the posterior wall. Now you can repair it. Now you are going from anti-mesenteric to mesenteric side from you have started. So you have already one end of thread is here. You are going from anti-mesenteric to mesenteric here. So two ends will be here. So you can tie both the end over here at the mesenteric border, right? And it will be better and safe for you. So rotate after reaching to the mesenteric side and tying it, rotate back the stay sutures from the mesenteric window now and cut the stay sutures. Check the patency properly, that there should be no leak. There should not be any space in between. There should not be eversion or inversion there, right? So after checking the patency, you are closing the mesenteric window also. That will be by the simple sutures. For continuous measure, same steps, which is continuous stitch with keeping in mind that no purse string sutures should be taken, because while taking continuous sutures, you can if you are putting more pressure over this and this side, it will be like it will create the pursue thing, like it will stretch and it will come closer and it will make this continuous suture a purse string sutures, right? So that should be kept in mind. So now end-to-end intramucosal anastomosis. As I said before, that there is an only difference between intra and extra is in extramucosal, this is anterior wall extramucosal anastomosis, in which you are not crossing the layer of mucosa. Here you are crossing the layer of mucosa. But second thing is, in extramucosal, you are going out from this serosa, you are entering from serosa, here from entering from the serosa, passing just above the mucosa and coming out from serosa, and you are tying knot above the serosa. Whereas in intramucosal stitch, you are going out from mucosa to serosa, again coming in from serosa to the mucosa, and again you are passing from mucosa. You are taking mucosa twice. That once you are going out from mucosa, entering from mucosa, exiting from mucosa, and again entering in mucosa, not tearing this thin muscle layer. You are passing again your thread, this V, if you can appreciate, you are passing your thread from mucosa, you are again entering mucosa, and on the same side, not like between the two cut end, you are tying a knot. You are tying a knot on the one side only, and after passing both the side of mucosa. That is full thickness mucosal stitch that will be looking like a vertical mattress. In vertical mattress, that is only we are doing that. We are entering from this point, we are exiting from this point, again we are exiting from this point, entering from this point, we are entering from this point and exiting from this point, and we are making knot over here, not on the center part, right? So it is like a vertical mattress. This was about the end-to-end anastomosis. So this was all about today's lecture. I'll discuss another notes, which is regarding the laparoscopic procedures. Haven't made that in depth, but the small effort of mine I'll share with you guys. Hope you have liked it, and if you have any queries, you can share with me, right? And you can ask questions. I'll share this PPT with sir also, so you can see, and I'll try to share my videos of this notes also with sir if you want to see it again. So